This is Betsy Jensen, and you are listening to Unstoppable Body and Mind, episode 132, Hypnosis for Pain Relief with Melissa Tears.
In this podcast, we learn to upgrade our brain and understand the power of our thoughts, to heal and to create the results we want in our life. Become the person in control of your healing and make peace with your life. Become unstoppable, body and mind.
Hello, my loves. Welcome. I have a special guest today. Hopefully, you're listening to this podcast soon after it comes out, because this very week she is doing her Integrative Hypnosis for Pain Relief class. I was actually at Melissa's conference with Simone Soul in Vegas a couple weeks ago. It was so hot in the middle of summer in July in Vegas. But the HypnoThoughts conference, super cool. So I'm so excited to have her on my podcast to share her with you. Here we go. Hey, everyone. Welcome. I have a special guest today. I have with us Melissa Tears. She's a hypnotist and a hypnotist trainer. She is the founder of the Center for Integrative Hypnosis, the founder of the Ethical Coaching Collective, and creator. Co-founder of the Ethical Coaching Collective and creator of Coaching for the Unconscious Mind, which is the actually we went to your I can't even think of what it's called, seminar. So we went to your seminar on marketing for the unconscious mind, and that's where we ran into each other in Vegas, the HypnoThoughts conference. And I've followed Simone Soul for a while, which you've partnered with, and I've gotten some really good ideas and tips just from some of the free stuff that you've put out. And then one of my coaches did your training, and so she taught me some really cool techniques too. And we haven't really talked about hypnosis on the podcast, but it like works so perfectly with all of the pain reprocessing stuff that we do talk about. It's probably even very similar, if not the same, some of the techniques with different words. So I'm so glad to bring this conversation up and to have you actually talk a little bit more about specifically the hypnosis for chronic pain, because you have a workshop coming up talking about that, right?
I have a training that I do, integrative hypnosis, and I've been training clinicians, doctors, nurses in hypnosis for pain management, amongst many other clinical applications. I have that coming up in November. My initial training, which is coaching the unconscious mind, is coming up in September. And that's where, between the two, that kind of constitutes how I personally have been addressing things like chronic pain.
Mm-hmm.
And the thing I have coming up is just really for people suffering with chronic pain. It's basically 2 hours of let's dive deep into hypnosis and different states of comfort. And then I'm teaching people who actually have discomfort or pain, chronic or otherwise, how to use hypnosis. So it's a $45 2-hour thing. I wouldn't say that's a training in hypnosis, but it's certainly what I would do if you came to me with chronic pain or pain of any kind.
Yeah.
And so that's coming up in just a few days. And whether or not you can get this out there is, that's up to you, but it's cool either way.
And there'll probably be a recording, right? If people hear this later.
Maybe,
Okay.
We'll see. We'll see
Okay.
how it goes. I do know there's a replay for anyone who who does sign up, and that's for August 8th.
Yeah.
6 to 8 Eastern Central Time PM. So, but my training, and I don't know how many coaches and clinicians that you have, really focuses on a kind of three-pronged approach to this subject, and most subjects really, because it really is more like practical neuroscience. So while traditional hypnosis for pain management has been studied for well over 100 years, from the early practitioners before there was actually any anesthetics used.
Oh,
Hypnosis
really?
started to become the preferred way. People would travel. James Esdale was a physician that people would travel days and days and days for, because he would use hypnosis as an anesthetic and performed hundreds and hundreds of operations back in the day where you just had to be held down while they sawed off your freaking leg, you know?
Oh my gosh. Yeah.
So just as hypnosis was starting to become like the thing
Yeah.
and make its way into medical schools,
Yeah.
ether came about, right? And it's like, oh, if we could just, put a cloth of ether over their face, that's a lot better than actually talking to our patients, So, but it never really went away, right? And if you Google hypnosis for, pain relief or pain management, or hypnoanesthesia, you're going to get a lot of hits. You're going to get a lot of research. So it's nothing new. Traditional hypnosis has always been used for pain management. What's new? What's newer? Because I've been doing this for 20 years at this point. It's not that new. Is the use of hypnosis and integrative hypnosis as I do it, is that you can go beyond pain management into pain relief, into actually fixing the very thing at the root cause of the chronic pain syndrome, right? So if you take the work of like Dr. John Sarno, you take the work, look, you're nodding, so you're I haven't listened to your podcast, so I'm not sure, what angles you've covered, but Schubiner, is that his name?
Schubiner, yes, exactly. He's one of the big ones, and Alan Gordon's The Way Out, where they talk about pain reprocessing. That's the term they're calling it, pain reprocessing.
Right. So I come at this from a few different angles. One is that angle, right? What are the unexpressed emotions, the unconscious emotions, right? So to me, who best to deal with the unconscious than a hypnotist? That is the playground that we play in. That's the pool we swim in, right? So quite often with like John Sarno's work, and it's so funny because, John Sarno's work I've been aware of for a long, long time. His daughter was actually a big fan of my old rock and roll band. So
no way. Oh, how funny.
But anyway, the thing about John Sarno's work is the only time it didn't work for people is when they could not accept the diagnosis of TMS or the chronic pain syndrome, the way it was explained by Sarno as this is your unconscious emotions, at play. And while I disagree with Sarno's very Freudian view of the unconscious mind, because he wasn't privy to the current research on the adaptive unconscious, I do agree that it is not necessarily unconscious emotions that can come into play. Unconscious beliefs, or rather beliefs that are not consciously evaluated. Also, even simply unexpressed emotions. So let me just back up a little bit. I developed my chronic pain protocol for myself. Chronic pain for most of my life with chronic migraines. And they said, it's genetic, or it's this, or it's that, or it's hormonal. It's when you started taking, birth control, or when whatever it was. One of the things that happened to me, I'm an experimenter, and I read Sarno's work and started to kind of put it to the test. I don't believe anything. It's just not in my nature. I have no faith, right? I have to experiment myself first. Then my students. And then my clients. We all get to learn with each other, right? And so I experimented first on my own migraine headaches. They were pretty severe. No neurologist could fix it. I was on every medication that they could possibly give. I had them since I'm like, I don't know, 13, 14, whatever. And so I started to look at Sarno's work and say, okay, I'm just going to pretend as if. What are ways that I hypnotically know how to get rid of unwanted emotions? right? How
Mm-hmm.
can I examine? Okay, when did it start? Let's go back in time.
Mm-hmm.
And then I looked at what was going on in my life that at 13, I might have not expressed. I
Mm-hmm.
might have not have even known how to express.
Yeah.
Oh, yeah, my father left, stopped talking to me for a year. And at the time, of course, I was busy tripping my brains out and doing all sorts of drugs, and it didn't even matter. I was just free of parental supervision.
Mm-hmm.
But now as a mother, as a grown-up, I think what might that 13-year-old have been feeling?
Yeah.
So I went back and I used some techniques. I used some tapping,
Mhm.
right?
Yeah.
EFT,
EFT. Yep. Yeah.
right? Not on the pain, but on the emotions that might have been contributing. Remember, I was in
Yeah.
experimental mode and I took notes. So I took category father, right?
Uh-huh.
The anger. Okay, maybe the guilt, maybe the this, maybe the that, right? Then I
Mhm.
kind of went through all of the possibilities. Then what am I not now expressing in my life? Each time I have a cluster migraine,
Mhm.
really do some sleuthing and find out
Mhm.
what is it I am not expressing, right? So the funny thing is I did this experiment. I used a few other hypnotic techniques. Then I went into a deep trance.
Mhm.
I kind of just did a general sweep,
Mhm.
right? A general, acceptance,
Mm.
acknowledgement of the emotions,
Mhm.
and then a releasing. And that I did from a much deeper trance state, right? Hypnosis state.
Okay. Yeah.
And I remember a couple of weeks went by and my husband said, "You haven't woken up with a migraine." And I
Mm.
was like, "Oh, yeah." And then like a month goes by, 2 months go by, 3 months. At this point, I'm like, holy shit,
Yeah.
there's something to this.
Yes.
So at like the 3, 4 month mark, I started to experiment
Mhm.
with other people. And a couple of other elements have contributed to this. Like I was helping someone with weight loss. They came
Mhm.
in and they said, I just do this emotional eating. So part one of my work is to look for where things get triggered. So, okay, when was the last time specifically you had these emotions triggered? We then use any type of repatterning, right? I do what I call a kind of practical neuroscience, which is to activate the neural network of the problem,
Mhm.
then use some of my techniques to throw in a prediction error, which thwarts memory reconsolidation, and
Mhm.
then put in, how we want to respond, condition that in, right? And
Yeah.
and really systematically start to change how the brain reacts and responds in these triggering moments. Yeah.
Yeah.
We were just doing the times where she was emotionally eating.
Mhm.
She comes back a couple of weeks later and says, I don't know what you did, but my back pain that I've had for 30 years has been gone.
Wow.
We didn't talk about pain at all.
Yeah.
And we went through where in her life she was getting emotionally triggered and she was eating.
Yeah. Wow.
And so I was like, there it is again. There
Yeah.
it is again. So I developed a whole protocol for chronic pain, that I teach to
Awesome.
practitioners and
Yeah.
nurses and chiro, you name it. It's what I think all people that help other people should know, right?
Yeah.
And so for me, the only time I start to get migraines, because I was free of migraines for years and years. And then I was in a situation where I could not be honest. It was a
Mhm.
professional situation. I was very angry at certain colleagues
Mhm.
because they were doing some stupid shit.
Mhm.
But in my professional setting, I couldn't say that, right?
Right.
And I had to support them
Yeah.
because that's just the right, in that setting. And
Yeah.
as I was literally supporting them and introducing them to the players at the conference and this and that, I started to get like the visual,
The aura.
yes. And I was like,
Yeah.
what? And it had been years.
Oh, wow. Yeah.
And, before very long, bam, I had a migraine headache and I had to
Yeah.
teach at that conference. I was like, holy shit. So I ran to my room. I did tapping. I did all this. I jumped back into hypnosis, and I literally started to do all the hypnotic work I knew to do in order to clear that.
Yeah.
So unfortunately, I am ridiculously honest. And as I often say when I'm teaching pain management, it's not because I want to be like, virtuous.
Yeah.
Moral.
Moral. Yeah.
Yeah, it's not a moral shit thing,
Yeah.
it's literally, I don't want a migraine headache.
Yeah, you have to
And
be honest.
when I am incongruous, when
Yeah.
I am like at odds, when I'm not speaking my truth, and
Yeah.
that was what the whole, you called it a seminar. It's so funny. I never call them seminars,
I
but
don't know why that came to me. I could not for the life of me remember the word.
it was about marketing to the unconscious
Yeah.
mind. As you know, it
Yeah.
was really about getting congruent.
It really was. Yeah,
From
exactly.
an internal state of congruency,
Yes.
sharing what you do, sharing what you love with other people, not seeing other people as targets to be marketed to be
Right.
sold something. We were
Yes.
trying to bash the entire paradigm
Yeah.
of what up until now had been considered marketing. We
Yeah.
wanted to say, what is marketing? And you mentioned a lot of the free stuff I put out, because as we taught, marketing is helping people before they pay you.
Yes.
That's what you do, right? With this podcast.
Exactly.
You're helping
Yes.
people before they offer you money. Why? Because you want honesty out there. You want, some people are not going to resonate with me. And they have so many opportunities to find out if I'm a good fit before they actually should be plunking down any money.
Yeah.
Because we don't want someone who's not ready to hear what we have to offer, or doesn't necessarily like the fact that I am a New Yorker and I tend to curse like a trucker. You know what I mean? Some people are not meant for that.
Yeah, that's true.
And they should find a kinder, gentler, more maternal hypnosis trainer. I have trained so many thousands of people that are now, trainers themselves, that they can find a good fit. So anyway, so I don't even remember the question you gave me. Oh yeah, hypnosis for pain management.
Pain, yeah.
So basically the three-pronged approach is one, yes, look at if it's chronic, if it's a syndrome, look at what might be going on under the hood. Yeah. Where are they incongruent? Where are they not speaking their truth?
Yes.
Where are they trying to be someone they are not? Trying to be perfect, trying to be accepted.
Yep.
What's the unacceptable thing they're not saying? The other level with that is, the body really does kind of speak in metaphor. So like somebody will come to me and they'll have like, chronic neck pain, and I'll joke, who's the pain in the neck in your life? And they will never hesitate. It will blurt out.
Yep. Yeah.
Right? If it's sciatica, who's the pain in the ass you're dealing with?
In the ass. Yep.
Really do. I mean, whether it's the chronic syndrome of IBS and stomach issues, right? Who can't use stomach? Who makes you sick? All of these things, but also think metaphorically. What is the gut, right? It's what are the metaphors? It's movement, it's motility, it's traction. What don't you have the guts for? So I really do, being a hypnotist, dealing with the unconscious system, look at the metaphors. I listen almost literally to how people code things. And I listen literally to the body, because the body is the unconscious mind.
I'm glad you said that. I wanted to bring up that statement. Dr. Schubner says that a lot too. So I find that so fascinating. I think we don't really realize how much of our life is controlled by our unconscious and our subconscious.
Only about 98% of
Just
every
98% or so.
you make. You don't make a single decision, not a single decision that isn't mediated in so many different ways by the unconscious first. You
Yeah.
don't look through a conscious lens. You look through a lens that is unconsciously biased on
Yes.
every level. It's running unconscious filtering systems based on your history, your neuro associations, your
Yes.
culture, your
Yes.
hypnotic priming that you don't even recognize. You're being primed right now by the plants behind me.
Yes.
You're
And
being
even, yeah.
primed by the temperature of your room. The
Yeah.
fact that you're sitting on a cushioned chair,
Yes.
you're being primed by your body. That if you're sitting on a cushioned chair, your mind is more malleable. You're
Oh,
softer to change. If you were on a hard chair,
yeah.
pick a harder line because
Oh,
the brain
wow.
is the unconscious mind. And I could
Yeah.
go on and on with that stuff because it's, it's the land that I live in, but people don't want to think that. They don't like that. They don't want to know how unconscious they are, how
Mhm.
over 95 people will argue 95, 97, percent of their everyday walking consciousness is on autopilot.
Mhm.
And the brain runs on prediction. I say that all the time because that is how the brain functions. It's
Yes.
predicting responses. So it can
Yes.
only act how you've acted. It can only be how you've been. It can only feel how you felt because that is the nature of how the brain functions. Now we can change that, right? By actively noticing what's new and different.
Mhm.
And I don't know if you're aware of the work of Ellen Langer, but you would
Oh,
love her.
yeah.
Langer. Well, her new book is something like Minding the Body or The Mind in the Body, or but
Oh, wow.
if you just watch even 17 minutes of this woman,
Mhm.
mindfulness over matter. It's
Oh,
a
yeah.
video. She'll give you a bunch of little snippets of just how unconscious we are and
Yes.
how beginning to start to notice what's new and different, to
Yeah.
become more mindful.
Yes.
By becoming more mindful, we're not talking about mindfulness as it's like packaged and sold right now. We're
Mhm.
talking about the opposite of mindlessness,
Mhm.
which is most of how we walk around. So yeah, the body is your unconscious mind on so many different levels.
Mhm.
Now, when I do my work coaching the unconscious mind, it's really about paying attention to the body, paying attention to how the body moves, to what the body is telling me, right? Your full bodied yes means you agree with this,
Mhm. I
right?
know, I keep nodding my head, and as you're talking about the movements, now I'm like, "Okay, I'm assessing my own."
Also, elements of every emotion has a biochemical counterpart, a hormonal counterpart.
Yeah.
Every thought, right, has so much more than we're thinking a thought is. Right?
Yes.
And so the body is the unconscious mind because it is the instrument by which we are moving through the world.
Mhm.
And
And
we
even
move,
our different
yeah.
states, right? Our different, like, nervous system state, if we're in fight or flight, we could interpret something differently than if we were in a relaxed, calm state, right?
Oh, they've done so many interesting research studies that indicate just that. They had people like cross a shaky bridge
Mm.
to get their amygdala peaked, to get the adrenaline going. And then then they were approached by someone who was doing a survey, who then
Uh-huh.
gave them the number saying, call me. And it was, a good looking person of the opposite sex for most of it, or, I forget how. This was a study done a while ago. What they found was the people that were approached right after the shaky bridge, they were the ones that called the person because what
Mm.
they did was they misattributed their inner state
Ah,
with
yeah.
arousal.
Uh-huh.
And they've done this in countless different ways to show you that we will misinterpret, right? Our body, and
Mhm.
we'll make a conscious narrative like, oh, I must find that person attractive.
Mm.
Because our conscious narrative is always behind the unconscious, right? The
Yeah.
unconscious speaks first. It
Yeah.
processes first, and then we try and make a conscious narrative that fits that story, but
Yes.
mostly it's made up. Your
Yeah.
brain is making up stories every single moment. Your brain is making up the visual system, the auditory system. On many levels, this shit is truly made up.
Yes. So our brain is actually like seeing what it wants to see, predicting, creating, and even let's talk about memories too. I love how you described memories, because memories aren't just like static things that live in a file system in our brain, right?
That is the old way of thinking about memory.
Yeah.
The truth is, memory is like an active synthetic process. In other words, every time you recall something, you pull it out of many different regions of the brain. That's why that movie, the Eternal Sunshine of the Spotless,
Oh, yeah.
Eternal Sunshine of the Spotless Mind. You got that?
Yeah, something like that. I
You know what's funny? It was
vaguely know
actually
what you're talking
shot
about.
on my block in Williamsburg, and
No way.
in the movie, you could see my apartment building. We're
No
like,
way.
hey, it was
Oh,
shot.
that's awesome.
So anyway, there's all these weird interconnected stuff, but where they were like targeting a memory, but the truth is, every time we recall something, it's like we always say it's like a Word document,
Mm,
right? You open up the file, even if you're just making a couple of typos.
mhm,
Once you close the file, you only ever have access to the latest version
mm,
of that memory.
mhm,
And even this file system is a metaphor, because the truth is it's
mhm.
not filed in one place. It is
Okay.
always a compendium of pulling from all these different regions of the brain, right?
Mhm,
So once a memory is consolidated, we used to think it was this stable thing.
mhm.
Now we know that it gets pulled up by the brain and it becomes malleable again.
Wow. Yeah.
Typically, we're only making little adjustments, and that's why we feel like we remember this thing from way back when. But I always joke, if you ever go to a family event, you talk about the same day, how many different versions of that reality are you going to get?
Right?
Right? Because
Yeah.
everyone is interpreting it through their own unconscious filters, through their own neuro associations. Their brain is making it up, right?
Yes. And
According to
over
your own
time,
filtering system. And over time,
yeah.
every incremental little shift
Yeah.
creates a bigger distortion.
Yeah.
Now, what I train people to do is what we call therapeutic memory reconsolidation, which is, instead of these small incremental changes, we do a massive update,
Mm,
massive update on the emotional track
mhm,
associated with that memory, sometimes even going back to pre-verbal, emotionally learned, implicit learnings, which is the kind of learnings that, you don't necessarily have conscious access to,
mhm.
right? It's not episodic. It's not like, oh, I remember this and this and this. Implicit memory, that's like how you learn to ride a bike.
Mm,
Yeah.
mhm,
Well, so we actually can access those now in 100 different ways once you learn the elemental pieces involved in therapeutic memory reconsolidation. So it will
mhm,
take all of the systems, John Sarno's work, Schubinner's work, everybody's work,
mhm.
and give it and give it speed.
And give it speed. Yes.
I'm a New
Yes.
Yorker, right? I like shit to get done fast. I
Yes.
don't want this kind of emotional reprocessing to take longer than it needs to. What
Yes.
I like to do is I like to cook things down to the elements. I
Mhm,
like to say, okay, here's the 4 steps. And
mhm,
this is underneath, or the 3 steps for memory reconsolidation
mhm,
that is inherent in EMDR. It's inherent in most NLP. It's inherent in most of these reprocessing,
mhm.
right?
Yeah.
So let's just strip it down of all the window dressing, which
Mhm,
is, the cool techniques that we play with, the cool, interesting ways to do it. And let's
mhm.
pare it down and then add a little element of obviously understanding how the unconscious works.
Mhm,
And you don't have to trickle down through the
mhm,
conscious, conscious until it becomes unconscious. We can just
mhm.
get right in there.
Yes. And isn't there something where if you are able to change that emotional signature or that emotional part of the memory, it it's not like you need to do it for every single memory or every single event, right? Can you tell me more about that?
So one of the things about, so think about therapeutic memory reconsolidation, right? We activate the memory, we associate in, so we activate the memory and it becomes malleable again. With
Mm-hmm.
therapy, unlike the incremental, with therapeutic memory reconsolidation, what's really vital is that we put in a prediction error. Remember, if the brain runs on prediction,
Mm-hmm.
then it's predicting the old emotional response.
Mm-hmm.
As soon as you do any technique that thwarts that, that puts in, oh my God, I used to be so angry when dealing with this person. And now all of a sudden I've done this hypnotic technique
Mm-hmm.
or EFT or any one of the techniques. You know, that's the thing that I lectured on, right? We're all right.
Mm-hmm.
Doesn't matter which technique you're wedded to. If you look and there you see the elements underneath follow the same pattern, then we're all doing the good work,
Mm-hmm.
right?
Yeah.
Just in different flares.
Yeah.
We're dancing the same dance, it just looks different. We're
Yeah.
calling it something else.
Yeah.
So once you put in a prediction error, that is when the brain goes, oh shit, we need to update, right? It's a
Mm-hmm.
survival thing. So once you do that, right, it's an evolutionary process, this updating, right?
Mm-hmm.
It's how the species has survived.
Mm-hmm.
Because we need to be able to adapt to
Mm-hmm.
whatever the hell is in our environment. And that's when you put a prediction error in, like I used to freak out when I got on a plane and all of a sudden I'm calm, the brain goes, wait a minute, time to update. This is
Mm-hmm.
no longer a danger.
Mm-hmm.
And it actually unlocks, right? The memory from
Mm-hmm.
the synaptic, it manipulates the protein,
Mm.
unlocks it on a synaptic level.
Ooh, wow.
Then when it gets reconsolidated back into the different regions of the brain, when the memory gets reconsolidated, once that prediction error is in place,
Mm-hmm.
it changes the whole memory, and not just the memory, but the whole schema.
Mm-hmm.
What those memories, right, have caused people to believe,
Mm-hmm.
value, the limitations, the
Mm-hmm.
actions. They're all involved in that same neurological, neuroassociative cluster that
Mm-hmm.
is not just the memory, but the neural network associated with the problem, or in this case, with the chronic pain. So to
Yeah.
answer, you don't have to change every single memory because the brain goes generative. That's how it learns. You do
Mm-hmm.
a few key memories and
Yes.
the brain goes, oh, I get it.
Yes.
And it updates the whole pattern.
Yes.
So
So
that's,
cool.
I mean, I guess I got off topic a little bit, but that is one of the key pieces to work with chronic pain. There's another key piece. I need to teach my clients how the brain reads pain.
Yes. Let's
Too
talk about
often it's simplified. It's like, oh, there's a pain center in the brain. I'm like, there's actually 13 regions that have the capability of reading pain,
that. Mm-hmm.
9 of which we can kind of sort of access, even though they're kind of unconscious. Because remember, there is no pain
Yeah.
without the
No,
brain.
right. Yeah, the
So
brain is interpreting it. The brain is
yes,
creating it.
it's
Yeah.
creating it.
Yeah.
Now, the thing is, the brain, there's all these different regions of the brain where they have about 5% supposed to be devoted to the nerve cells that read pain.
Mm-hmm.
What starts to happen with chronic pain is it gets practiced.
Mm-hmm.
And with practice, neurons that fire together, wire together, those different regions start to devote more and more real estate to reading pain signals, sometimes 10%, 15, 20%. The
Mm-hmm.
problem is those regions are supposed to be doing a hell of a lot of other things.
Yeah.
Some of those regions are meant for planning, creativity. Some
Mm-hmm.
of those regions are all about controlling your emotions, balancing your emotions, your sense of self, who you are in the world. Some
Yeah.
of them are devoted to touch, to
Mm-hmm.
pleasure. to all of these things that fall by the freaking wayside when people are dealing with chronic pain for years, right? All of a sudden, they can't follow through on their plans. They can't plan anything because their plans are always being thwarted by their own pain syndrome. So
Yes.
what I teach is all the different ways to use the visual system, the touch system, even the olfactory system to
Mhm.
start to take back the real estate,
Mhm.
to use metaphors. So I teach them self-hypnosis where they can go inside and
Mhm.
start to do the things to take back the real estate from all of those neural regions,
Yeah.
right? Because that's the way that anesthesia works, right? It shuts down the thinking part of the brain.
Yeah.
There's still regions
Yeah.
of the brain that are definitely reading the goddamn pain signals, but if
Yeah.
it doesn't get to the thinking part of the brain,
Yeah.
it doesn't bother us.
Yeah.
So pain is in the brain. Yes, pain is
Mhm.
created by the brain. So
Yeah.
that is what I teach my clients to approach so that they feel less, number one, helpless.
Mhm.
They start to actively take part in their healing. This is the
Mhm.
key thing. To me, my entire 25 years of doing this work has all been about empowering the client,
Mhm.
right? How do I teach the client how to stop their anxiety? How do I teach the client how to change their own memories? How do
Yeah.
I teach the client how to change their own brain,
Mhm.
right? Because I am not a therapist. I don't see clients for 6, 7 years. You
Yes.
know, while I have clients that, that will touch base with me over the years, like I
Mhm.
always, because I work with a lot of kids and teens. So
Mm.
I love knowing that I'm their backup if
Yeah.
they need me. There's someone that, I helped when they were 13 with anxiety for school, and then 16 for the, for the tests, and then
Yeah.
18 for college admission, and like their first heartbreak, their first job,
Yes. All
their
those.
first,
Yeah.
so, but for the most part, I see people for a few sessions because I'm arming them to change their own brain.
Yes.
And to me, it's a key part.
I love that. Yeah. Well, and just maybe some definitions, like when we talk about hypnosis and self-hypnosis, in case people have an idea of, like you have to watch a pendulum or a spinning circle, or like how do you describe hypnosis and,
No,
and self-hypnosis?
so honestly, I describe it in many different ways depending on who I'm talking to. Yeah.
Mm-hmm.
Because there's so many different ways of interpreting it.
Mm-hmm.
The one way is, hypnosis is really a form of language and nonverbal communication
Mm,
to access people's imagination, belief, expectation
mm-hmm.
that leads to an altered state
Mm,
that leads to an altered subjective experience.
mm-hmm.
Now, that's a very wordy way of describing it, but it's kind of accurate, right? I'm using language and nonverbal language,
Mm-hmm.
right? To get people to excite their belief system, their imagination, their expectation, and
Mm-hmm.
then to alter their subjective reality, whether that is making some chronic pain feel like numbness or feel like cotton, whether it's going into an altered state of consciousness where they have more access to the unconscious system and can, imagine a volume control and turn it down. And
Mm,
that works. Like there's so many different ways. Another simple way that I explain it to clients is this. Imagine like this is a barrier and
mm-hmm.
you've got like your unconscious mind, which is, as we discussed, 98% of you,
Mm-hmm.
right? This is where your beliefs are, your long-term memories are, your emotions are, your habituated patterns are. Anything done with repetition, felt with repetition, thought with repetition creates an unconscious program.
Mm-hmm.
And here is this tiny part of you that thinks it runs the show.
Mm-hmm.
Now, that is a very powerful part because on many levels, it can be driving this whole bus.
Mm-hmm.
Okay? But it has to understand that there's a lot going on under the hood that makes that bus go that we don't have to consciously know. We just have to know how to, put the key in the ignition and press, put our pedal to the metal or whatever. Can you tell I
Yeah.
don't drive? Anyway,
Yeah.
but quite often what happens is we can make a suggestion, and if it doesn't gel with what's in here, that wall will stop that suggestion from going in. With repetition, people can eventually get their idea practiced enough to create an unconscious program. With hypnosis, we push that aside. So our suggestions go right in to the unconscious system in charge. Got it? That's a very simple way of understanding it. Please understand that you don't need a hypnotist to push that shit aside. A good director will do it. So there's really two things that are vital for hypnosis to be present. A narrowing of attention and a pushing aside of this, what they sometimes refer to as critical faculty. But you do that every time you get lost in a movie or a good novel, because people don't realize that. They sit down to a movie theater and they narrow their attention to the screen, number one of what's needed for hypnosis. And without even knowing they're doing it, they push aside their critical faculty, otherwise known as suspending disbelief. In order to watch that movie, if you watch that movie with the barrier up, you'd never be able to forget that that's an actor. There's a director, there's a lighting crew, there's a sound crew. None of it's real. But we don't want to think that when we're watching a movie. What we do then is if we didn't, it would never have access to our memories, our emotions, our beliefs, our values, the very thing that Hollywood banks on. So we push it aside. What does that mean, actually? It means that when you're watching a movie, this barrier is pushed aside. You're hyper suggestible. But when they want you to jump, you jump. They want you to cry, you cry. But here's the important thing. Because it's pushed aside, when that movie gets scary, and this is how you know how powerful even a light hypnotic state can be. The idea on that screen while watching the movie, if it gets scary and I'm open to that suggestion, then my body changes. My nervous system goes on high alert. My brain says, oh shit, and doses me in adrenaline, cortisol, all the stress chemicals. It sends extra blood and oxygen to my arms and to my legs so I can fight or flight, but I'm just watching a freaking movie. It elevates my heart rate, my blood pressure, everything. So here you have an idea, a movie can affect the unconscious system, which is the fight or flight system.
And affect our body, and it changes physically.
And that's how you know you're in a hyper-suggestible state, which is what hypnosis goes for. We want you to be open to suggestion. In my form of hypnosis, it's open to your own suggestions. It's open to the suggestions of that deeper part of you that knows better, that knows the emotions that are at play, that knows the truth that you're not speaking, that knows where you're incongruent. Hypnosis can help people to dive very quickly into a place where they have access to their own intuitive knowledge. The knowledge that, for the most part, you and I are exchanging millions of bits of information right now. Right? But we can only be conscious of, research indicates, around 40. So think about how much information you actually have in your unconscious system, that your adaptive unconscious is literally processing millions of bits of information every single moment, then creating these narratives, right? Creating these stories. And then the conscious mind is like, I have an idea, and takes all the credit. Eagleman, in his book Incognito, talks about that. He talks about how it's kind of likening like a newspaper where the unconscious mind does all the research, does all the writing, does all the editing, and the conscious mind just is privy to the headline and takes credit for the piece.
Yeah, it's fascinating to me too how many times people will say, with pain. Oh, I got this pain, but I wasn't stressed about anything, or I wasn't thinking about anything stressful. But our conscious mind, we're only aware of such a small percentage.
Such a small bandwidth.
Yeah.
I know some people will be like, well, I think you're wrong there because it really started hurting on vacation. And I will say, yes, when you actually had time.
Yes, right. Sometimes it's, yeah,
When you weren't
when
being distracted by your
we're
normal life.
distracted. Yes. Right.
Yeah.
Yeah, definitely. Yeah, if someone is struggling with chronic pain and they're having some kind of symptom, even if they're not consciously aware of what they're stressed about, or if they are stressed or not, could be an indication, just because your body is having that reaction, to dig a little deeper, to get a little
I
curious
mean, that's
about.
it, because everyone is saying, everyone thinks they are responding to the external environment.
Yes.
And yet, how much of our experience, I mean, all of it, honestly, all of our experience is an interpretation of the external environment and the internal environment. We
Yeah,
think we know what the hell we're talking about, and we don't.
we really
We are
don't. We're
so
just
unconscious.
making it up and
Oh
putting
my
things
God, we're
together that
making it up.
don't belong, and they.
You know, when I say that and people take exception to it, I'm like, I don't think you understand just how made up this is. And
Yeah.
part of it is like, I take simple systems, like we think we're seeing the world. We think that we're like, behind the camera, like behind our eyes, and it's a big camera looking out at the world. No, our eyes are only getting frequency. It's only getting photons, and that's hitting a certain area of the eye, which is then translating these photons into electrical signals that go to 6 different regions of the visual cortex, and then it flips it upside down or right side up and then shows it to us as reality. And then if you're not walking around with 2 gaping holes in
Yeah.
your peripheral field where
Yeah.
your blind spots are, where there is that blind spot is, there's no photoreceptors there.
Yes. Right.
But
There's none
we
at
don't
all.
walk around with 2
Yeah.
gaping holes in our reality because the brain likes cohesion. So
Yeah.
it makes shit up. It literally
Fills it
looks
in.
at your environment and says, oh, the walls are green and there's a curtain. Let me
Yeah.
fill in. Let
Yes.
me just fill it in,
Yes.
right? It's
Yeah.
best guess
Doing
of
this
the
all
environment.
the time. And we're not even aware. We're just thinking we're like looking at a screen, like you said, or
Right.
looking
And
out.
this is, it's all interpretive. And
Yes.
you can't, it's not even pure interpretation. As I said, it has to go through your unconscious filtering system, your expectations of what you believe should be there in your visual system,
True.
in the environment. And that's just vision. The same thing happens with auditory.
Yeah.
But anyway, we could go really deep down that rabbit hole of this shit is all made up, because I always do, because on a subatomic level, holy moly, are we making shit up?
Yeah.
We
And
won't go there
no.
because it's almost an hour that we've
Not
been talking.
today. Okay, yeah, not today. But that is so important with pain, because so many times we think it's, oh, it was the arthritis or the degeneration, but people who've listened to this podcast and know this work, we know that a lot of those things happen in people that don't have pain. They don't have
Sure.
chronic pain, right?
They've done studies with something like, I think, 500 people where they looked at their spine. Yeah,
Yeah,
you
it's like
know,
3,000. Yeah, 3,000 people. Yeah,
3,000 now. See,
3,000
back in the day,
pain-free people. And the
every one of
results
them
are,
had some
yes.
aspect of degeneration. Yeah.
Yeah, it's actually more common
Yeah.
than not to have some kind of degeneration.
And before we say all that, there is going to be some people that have kickback to that. Trust me, I've been doing this a
Yes.
very long time.
True. Yeah.
Because unfortunately, people, without being given the whole wide explanation of how our brain makes shit up, people
Mm-hmm.
are being dismissed by doctors
Mm-hmm.
by saying it's all in your head.
Mm-hmm.
We have to address that too, of what that means. It doesn't mean that you're making it up. It means that the brain really is the ultimate constructor of reality. And
Yeah.
so I have to soften that blow, because too many people have been dealing with a medical system that, especially if you're a woman, don't get me started,
Yes.
it's all in your head.
Yeah.
And then we also have to address the fact that there is acute pain. There is pain that is caused by a
Sure.
broken bone or a syndrome or a disease. And you actually are feeling pain because something is really wrong with the body. So like, I won't see people for pain management unless I know they've been checked out by a doctor. I used
Mhm.
the real stickler
Yeah.
for, and still am, honestly, that pain is a signal. What is it telling you?
Yeah.
Have you had the medical checkup? Because hypnosis works wonders for actually masking pain. And I
Mhm.
never want to mask pain without knowing what the hell the pain is about. And
Yeah.
quite often it is about the unresolved emotional conflicts,
Yeah.
right? If
The
it's
majority of the time. Yeah. Yeah.
but anyway, so we do have to say that because there's exceptions to every rule.
Yes, yes.
You know,
Dr. Schubner is good about having people, he says get checked out. We want to rule out tumors and fractures and infections, things
yeah,
that need medical care and attention.
it's
But the
important.
vast majority of chronic symptoms have been learned and predicted and created and amplified over
Yeah.
time
Well,
by the
one of the
brain.
things that I often think about, right? They say that in a year, let's say a year, you and I are talking. The you that is talking to me on a subatomic level, on a cellular level, 98% of every subatomic particle that makes up who you are, your physical body, will be different.
Wow. In a
Think about it for a moment,
year.
right?
Wow. Yeah.
Will be different because right now, since we've been talking for an hour, billions of cells
Yeah.
have died, billions of cells have been born. Our body is constantly rejuvenating, replenishing,
Yeah.
recycling itself.
Yes.
Right? How many weeks does it take to grow a whole new stomach lining? How is it we keep these chronic syndromes going if
Mhm.
every actual physical cell is being replenished in 7 years? Every aspect of our body will be different. How
Yes.
can we have a chronic condition
Yes.
for 20 years?
Yeah.
What are we doing?
That's a good point.
Think about it. How
Right.
so then you start to really get into the interesting layers of epigenetics and how
Yeah.
we are literally how our filters, our cognition, our beliefs, our values, right? As I said, every thought, every emotion has a biochemical counterpart. The biochemistry and the hormonal chemistry going through our system is actually the environment that the cells, that the genes
Mm.
are living in, and they
Mhm.
know how to express themselves.
Yes.
So what changes that environment is perceptual,
Yes.
is
Oh,
emotional.
yeah.
I mean, we could dive really
I
deep down
love it.
that rabbit hole.
Yes, epigenetics. It's so fascinating. And yeah, it's cool because I've seen a client who she had I think it was a test for mold or something, and they were able to say, yes, this gene is activated. And then after this work, oh, this gene has turned off. So it's,
Right.
this is
That's
what
where
we
the
need to
really
remember.
interesting stuff comes in. And,
Yeah.
I mean, as a hypnotist, again, because we have the tools to dive deep,
Hmm.
right? And not have to wait for the kind of, trickle down conscious repetition to get
Yes.
unconscious, we
Yes.
kind of get in there.
Yes.
We can spur on those changes faster. So that's what I meant by hypnosis gives it a bit of speed. It
Yeah.
gives therapeutic memory reconsolidation the speed. It gives John Sarno's the work, right? Where we started off by saying the people that didn't get better didn't accept the diagnosis, right? Their critical faculty would not
Hmm.
allow, but push that aside. And
Yeah.
then instead of suggesting the diagnosis, open it up for the own wisdom,
Yes.
where we say, what is the lesson here? What are the emotions at play?
Yeah.
What's underneath the pain?
Yeah.
So a lot of that kind of exploration, right? Drop through the pain, what's underneath it?
Mm-hmm.
And that emotion, let's drop through that emotion, what's underneath it?
Mm-hmm.
That emotion, what's underneath it?
Mm-hmm.
Who are you underneath all that bullshit?
Mm-hmm.
And then we grab that resource, we grab that, and then we bring it back up through those layers, now more resourceful, with
Mm.
understanding, with insight. And that's when change happens faster than you can think consciously.
Amazing.
Anyway,
Are you going to be teaching some of those techniques in the workshop?
it's funny.
Course.
It's really, I'm going to be teaching a bunch because there's quite a few hundred people at this point
Yeah.
that want to be on that call, or at least get the replay. So what I thought I would do is kind of give like a taster of a bunch of different things so that
Yeah.
more people will have the possibility of transformative change. But I'm definitely going to be teaching self-hypnosis so that
Mhm.
people can go into their own states and then play with the different ways of, looking for pain relief.
Yes, absolutely. Okay, awesome. Good. Yeah, I think it's great to,
You
yeah,
know,
we'll put a link for that in the show notes too, because definitely so helpful in any aspect of life, but especially with chronic pain.
yeah. I mean, that is we all have chronic habituated patterns. Pain tends to get our attention more quickly
Yes.
and strategically
Yes.
than,
Yeah.
let's say, the anxiety or the depression, or, there's many different manifesting ways, right? But pain is
Yes.
the one that grabs our attention
Yes,
because we can't
exactly.
look
It
away. Yeah.
brings you to the work. And I always say, yeah, this is the kind of work that, a lot of people end up doing in their lives anyway, to be more congruent or to be, mentally healthier.
Yeah.
And it helps our physical body too. So it's what brings a lot of people to this work, but it's just good overall work to do anyway, to get out
Yeah.
of that unconscious mind, to start living a little more consciously, to start being aware of even all of that we're carrying around and shed those things that aren't helping us
It's
anymore.
and on many levels, that it's impossible to get, out of the unconscious mediation of our brain, of our life, because we wouldn't be able to move if we had to consciously walk across the room, but
Yeah. Yeah.
as you said, bringing awareness to it, having an awareness to it, being open to the possibility that what you think might not be the full story, is
Hmm.
always good for all of us.
It
But yeah.
is. Yes.
Well, thank
Okay.
you for, having, is there anything else that I didn't answer that you'd like to ask?
No, I think those were the main things. Absolutely. And we even did more. So, unless there's anything else that you've thought of that you'd like to add, I think this is so great. Super
All of
helpful.
these different ways that people can get out of it. I've been helping people for a very long time,
Hmm.
who have pain that, all of the kind of established medical community just says you have to live with. And
Yeah.
they don't really have good advice except surgery or medication. But the truth is, over 25 years, I've seen so many people absolutely shed this, this chronic pain um, altogether. So there's a
Yeah.
lot more hope
Yeah.
than people would think. But anyway,
I think so
it's been fun
too. Yeah.
thanking you for for the invite, and it's always a pleasure for me to help in any way that I can people with pain, because I've been there and I've done that.
Yes.
you know.
Well, it's so amazing. I love your story. I'm glad you shared it. And we'll have those links in the show notes for people who are interested. And hopefully this is helpful, even if all you do is listen to this, just getting a little more awareness, because it doesn't have to be a formal hypnosis practice. It's just coming to that kind of more focused and
I mean,
malleable state.
once
Yeah.
you really get that almost all hypnosis, at least in the kind that I use, is
Hmm.
self-hypnosis, then
Mm.
you can do so much work by yourself. All right.
So awesome. Awesome. Okay. Well, thanks again, Melissa. It's been great talking with you today. Take care, and we'll be in touch.
And have a good
Right.
one. Bye.
Bye.
Thank you so much for listening. I hope you learned a little bit about your brain today that helps you in your life like it helped me. Please be sure and subscribe and leave a review. And of course, be sure and share this podcast with someone you know that wants an unstoppable body and mind.